The University of Maryland School of Medicine's renowned faculty, their teaching, research, and clinical programs greatly improves the lives of the citizens of our city, state, and nation. This excellence and innovation now reaches out to every continent and the people of the world.
Or discoveries or research or clinical cure models are having a tremendous impact, reaching millions of people, thousands of miles around the world.
In the 21st century, medical issues are no longer regional or national. They're really global. The training paradigms, the research findings, and the models of care that are developed at the University of Maryland are really applicable all over the world.
This globalization of medicine forges ahead daily at the Institute of Human Virology, offering new hope to the citizens of Africa. The IHV programs that treat over 4,000 HIV-positive patients annually in Baltimore have proven to be effective models of care for the world.
We've established an affiliate of the university called the Institute of Human Virology Nigeria, which has a three-part mission: care and treatment, where we have over 70,000 people on therapy, and we've screened upwards of 400,000 people for HIVs. A research and research training program for Nigerian scientists to be able to conduct research.
To do that, not only do you need the resources, but you, in the terms of money, not only do you need to build the systems, but you need a whole generation now of doctors and nurses and healthcare professionals that have the ability to function in the environment where they're required to function.
I come from Zambia. I've come to do training so that when I go back home, I go and teach my other colleagues on the treatment and care for people that are suffering from HIV and AIDS.
And we're now involved in the therapy of close to 300,000 people in Africa, which is about 11% of the total world's therapy help to Africa. So you can say this university, this medical school, this institute alone are treating more than 10% of all Africans.
Dr. Adrian Park trains surgeons in Baltimore and in West Africa. Working with the Pan-African Academy of Christian Surgeons, he develops comprehensive surgical residency programs whose graduates assume health leadership roles in local and often remote communities.
And if you have an excellent surgeon and an excellent surgical program, this can absolutely revitalize, almost resurrect the hospital. And one of the remarkable things is when the quality goes up, when the quality of care goes up, I mean, Africans, like the rest of us, are smart and will migrate to quality.
Dr. James Caper's research has worldwide implications, with the potential to prevent cholera epidemics at times of natural disasters, which compromise a country's water supply.
So this is a vaccine, the cholera vaccine that we developed, was the first genetically engineered bacterial vaccine of any sort to be tested in humans, and the first genetically engineered bacterial vaccine to be licensed.
Dr. Christopher Plowe's molecular approach to understanding drug resistance and vaccine development has the potential to eradicate malaria, a disease responsible for killing millions of people each year, primarily children in Africa.
And I became interested in trying to figure out if we could use that molecular knowledge to actually guide malaria treatment policies in the field to try to make sure that people with malaria are being treated with a drug that's effective.
In addition to finding effective drugs to treat the disease, Dr. Plowe is also working on several potential vaccines now in drug trials going on in Malawi, East Central Africa, and Southeast Asia.
We're now beginning to describe the extent of the diversity in malaria parasites out in the field in Africa, and are trying to use that information to design vaccines that will protect against all the different variants out in nature.
Dr. Myron Levine, director for the Center for Vaccine Development, leads a team recognized worldwide for success in developing and testing vaccines against cholera, typhoid, malaria, and other infectious diseases.
We were the first academic center to pull together all the multidisciplinary components that are needed to develop and test and introduce a vaccine and pull all those disciplines together under one roof. And we are seeing major interventions saving hundreds of thousands, millions of lives every year.
Dr. Maureen Black's research has identified pervasive malnutrition as an urgent problem for both the children of Baltimore and those worldwide. For these nutritionally deprived youngsters, as many as 6 million will die each year.
Based on the studies that we published last year, there are over 200 million children under age 5 from around the world who are not reaching their developmental potential. This is outrageous. This is also a very conservative estimate.
Interventions are very low cost and easily implemented. However, as children can't advocate for themselves, it is our responsibility to ensure their needs are heard.
It demonstrates to a country by ensuring the health and development of their young children, they're really providing for the future of the country.
Patients come from around the country for internal surgical interventions at the Center for Advanced Fetal Care. The innovative techniques developed through research at the center save the lives of babies and translate into better care for pregnant women of every nationality.
Now it looks like if you give aspirin to women that are truly at high risk, and if you give it early enough in pregnancy, so if you give it in the first 11 to 14 weeks, then your reduction of preeclampsia is between 50 to 80%, which is phenomenal.
Dr. Claudia Baquet, the Associate Dean for Policy and Planning, champions issues related to health disparities. Our national outreach through her programs and those of other faculty are widely recognized for their excellence. Our new leadership in stem cell research at the Center for Stem Cell Biology and Regenerative Medicine offers one of the most promising frontiers in the global fight against cancer.
Not just for stem cells for transplantation, but for the understanding that we will get of almost every disease that humans suffer, and then develop a simple medicine, hopefully a pill, that you could take that could be a whole world therapy for that disease. Or even better, what if we could find out what was going wrong and prevent it from going wrong in susceptible individuals?
When disaster strikes anywhere in the world, our faculty is dedicated to providing humanitarian aid to help people in their greatest moment of need.
The commitment to care at the Shock Trauma Center transcends Baltimore and transcends the state of Maryland. Everybody's committed to delivering health care everywhere in the world if necessary. If there's a hurricane in Louisiana, if there's an earthquake in China, we're ready to go. We're committed to doing what we can do to help eradicate injury and suffering anywhere in the world.
Or discoveries or research or clinical cure models are having a tremendous impact, reaching millions of people, thousands of miles around the world.
The University of Maryland School of Medicine is a leader in training physicians, providing care, and developing programs to improve the health of citizens of Maryland, the nation, and the countries of every continent.